Good afternoon and welcome to the City of Toronto's COVID-19 media briefing for Monday, January the 25th, 2021. Joining us today is Mayor John Tory, Toronto's Medical Officer of Health, Dr. Eileen de Villa, and Toronto Fire Chief and General Manager of the Office of Emergency Management, Matthew Pegg. Mayor Tory?
Well, Brad, thank you and good afternoon. 1 year ago today, Toronto Public Health confirmed the first case of what's come to be known as COVID-19 in our city. Much work was done by our health professionals ahead of that first case arriving in Toronto, and much more work, of course, has been done since then in the past year to confront the pandemic. I want to take this opportunity on this unfortunate anniversary to thank our frontline workers in our hospitals and in our long-term care homes, just to name two groups for all the work that they've done this past year, joined by many others. But I do want to pay special tribute to our own team at Toronto Public Health. This is, of course, their area of training and expertise, but nothing could possibly have prepared them for the long, intensive, sometimes tragic course that this pandemic has taken. They have addressed this public health crisis with professionalism and incredibly hard work, and I thank them for that on behalf of myself as Mayor and on behalf of all of the people of the City of Toronto. We will never forget all of our frontline heroes. Throughout this crisis, we have been focused on making sure we do everything we can to save lives and to stop the spread of the COVID-19 virus. It has required tremendous sacrifice of all of our residents and so many of our businesses, sacrifices of many different kinds. It's been a year of hardship and, sadly, a year of tragedy for many families. We will never forget the lives lost. I want people to really think about that for a moment. More than 2,000 Torontonians have been lost to COVID in a year at most, because the loss of life didn't really start for some time after the anniversary that we're marking today. This is a loss of life that is almost incomprehensible in a place like this, and should cause us to redouble our efforts to bring this pandemic to an end. And I know we're all determined to move forward this year and to defeat this virus this year. And that's why the city government is working to make sure that we do everything we can to help the federal and provincial governments to roll out the vaccines over the coming weeks and months. And while the vaccines are welcome and hopeful news, we are not letting our guard down yet. The virus remains a very real threat to each and every one of us. We must all continue to stay home as much as possible and to follow the public health advice. Wear your mask, keep your distance from others, wash your hands. Dr. de Villa will outline today the steps that Toronto Public Health is taking to warn institutions about the UK variant of the virus and encouraging places like long-term care residences to take the steps, to do the assessments, to look over everything, to take all steps necessary to harden their defenses against the virus. We're also continuing to advocate for proper pandemic sick pay. Today, the mayors and chairs from the 11 largest municipal governments across the Greater Toronto and Hamilton area, representing millions and millions of people, called yet again for federal and provincial action on the sick pay issue. Despite the ongoing lockdown, the GTHA continues to see extremely large and troubling outbreaks in essential workplaces. Although there is the Canada Recovery Sickness Benefit from the Government of Canada and provisions by the Government of Ontario to protect employment for those who are ill, we know that people continue to come to work with COVID-19, often because they're afraid of losing their paycheck. The best advice from our public health professionals right now, and it's been their advice for a long time, is to address this issue with improved sick pay benefits for those with COVID-19 or for those who are afraid to go and get tested because they might have COVID-19. This would at the very least include, during the pandemic, an enhanced benefit which comes closer to replacing income for those who have to take time off work to isolate, a simpler application process, and an immediately available benefit without days or weeks of delay before it's received. Failure by the federal or provincial governments to address this issue will result in people continuing to avoid being tested and continuing to come to work sick. Updating the sick pay benefits available will save lives and will help bring the virus under control faster here in the province of Ontario. The mayors and chairs strongly urge the provincial and federal governments to take urgent action on sick pay. Please step up and make this guarantee for the duration of the pandemic. As the mayors and chairs have pointed out many times, failure to address this adequately is putting health at risk and will ultimately lengthen the time needed for other public health measures to be left in place. Investing more in pandemic sick pay now is an investment in protecting the health of all of our residents and one of the best investments that can be made in expediting the long-term economic recovery of the GTHA and thus the entire country. The mayors and chairs also discussed the matter of travel and how best to ensure that people coming and going to and from Canada doesn't make the problem, the COVID problem, worse. It was agreed that stricter travel measures now would be appropriate. And it was agreed that the management of the virus, and likely the variant as well, calls for additional screening and monitoring measures. The federal government is urged by the mayors and chairs to adopt increased quarantine enforcement mechanisms, including technology, which do not rely on local officials who are already very hard-pressed. In addition to the recently instituted 3-day advanced testing requirement for travelers arriving in Canada, the mayors and chairs urged the federal government to consider additional testing measures at the airports to detect the presence of viral variants. I think it's important that the federal and provincial governments know these actions have the full support of the City of Toronto and the leadership of all of the large GTHA municipalities. It is my hope that they will take these actions soon in order to help us all protect the health of our residents and to save lives. You'll recall in the early days of the pandemic, we stressed many times that fighting COVID-19 would be a marathon and not a sprint. I know today, a year after the first case arrived in our city, it seems like this is an endless marathon. But we have made progress. A year ago, there was no vaccine. There was COVID, but there was no vaccine. Now, we will soon begin the task of distributing the second dose of a vaccine to residents in our long-term care homes and working to make sure that we're ready to administer COVID-19 vaccines to all residents. We are closer to the finish line of this marathon than the starting line, but we still have a long way to go. That is reason for all of us not to give up hope for a COVID-free future on this late January day, and this anniversary we'd probably rather not be marking. And on that note, I will ask Dr. de Villa to present her report for today.
Thank you, Mayor Tory, and good afternoon. Today, I'm reporting 767 new cases of COVID-19. 13 more people are in hospital, bringing the total to 508. Sadly, 15 more people have died. With regard to COVID-19 data, I want to let you know about a temporary change in our reporting that will be reflected next week. We will still provide the new cases over the previous day, as well as total cumulative cases, new hospitalizations since the previous day, ICU admissions and intubations, deaths since the previous day, and cumulative deaths. The reason for the temporary change is that Toronto Public Health is migrating to the provincial case and contact technology system. This will bring all public health units in the province into the same system. This is entirely technology systems related, and the project is expected to be completed next week. The project does not affect Toronto Public Health's day-to-day operations, so otherwise it is entirely business as usual. On another note, there is a lot of discussion today about COVID-19 variants and the risks they pose. The UK variant B.1.1.7 is now confirmed as the strain of COVID-19 that spread through Barry's Roberta Place long-term care home. My understanding is that 129 people live there. 127 tested positive, as have almost 90 people who work there, about half the staff. 40 people have died. This is a terrible price paid and a stark warning for the rest of us. Toronto Public Health has today contacted all long-term care and retirement homes, as well as complex continuing care and rehabilitation hospitals, to get them to review, audit, and reinforce their current infection prevention and control measures for COVID-19. These measures include screening of residents, staff, and anyone who must enter these facilities, universal masking, supply and use of personal protective equipment, consistent thorough hand washing protocols and requirements, physical distancing measures, environmental cleaning, surveillance testing, and auditing. Other congregate and group settings are being similarly advised. Toronto Public Health's Communicable Disease Liaison Unit is engaged, along with our long-term care and retirement home liaisons, and the infection prevention and control advisors and supports available through Toronto hospitals. In this environment, it is a relief that the first round of vaccinations have been delivered in Toronto at all 87 long-term care homes and all high-risk retirement homes. The fact is, infection prevention and control is truly everybody's job now, everywhere in Toronto. There is still a lot of work to do to conclusively understand the extent to which the known variants are more transmissible or if they cause more serious disease. We know the UK B117 variant is in Ontario. We must assume it will spread. With that in mind, the most important thing to do is to act in ways that protect yourself and everyone around you. COVID-19 is a dangerous virus in any form. We never know if infection will lead to mild illness or to worse. A survey out of the UK in November found that 1 in 5 people still had symptoms 5 weeks after their acute COVID infection had passed. 1 in 10 identified symptoms 12 weeks or more after their initial infection. This is a phase of the pandemic where the choices we make will have real impacts on the health of others, for better or worse. We can create barriers to variants spreading widely if we avoid situations where COVID-19 can spread. You have heard before what I am going to say next. I hope you will take it to heart more than at any other time. This means keeping apart as much as possible. It means making as few exceptions to contact as we can. So I want to return to actions I advised often last fall. Every time you have to make a decision that could put you into contact with other people or require you to leave home, ask yourself, is this something I have to do, or is this something I want to do? And if it's something I want to do, can I not do it? Can I defer it? Or can I do it online? And if none of those are possible, what is my plan to make the activity as low contact as I possibly can? You know I am sympathetic to the sacrifices and the strain of life in the COVID-19 pandemic. But for now, the time has passed for focusing on impositions, inconveniences, or frustrations. This current situation, in the simplest terms, is not good. For now, we need to focus on things as they are and do everything we can to make sure that things don't get worse. Many people today are noting an anniversary we'd like to forget. A year ago, we announced the first confirmed case of COVID-19 in Toronto. I wonder who imagined then what life would look like a year later. Almost 83,000 cases in Toronto. More than 5,200 people hospitalized. And 2,324 lives have been lost to COVID-19. I believe it is possible that in 2021, we can pick up with the best of where we left off. With schools back, with the freedom to move, with one another's company, and do it all in safety. But there's still a way to go, and it will demand a lot from everyone. But we have learned a lot, and we know what to do. I encourage you to imagine that a year from now, life can look so much better than it does right now, and to lean in hard in the effort to get us there sooner, healthier, and together. With that, I'll now turn it over to Chief Pegg to deliver his remarks.
Thank you, Dr. de Villa. Good afternoon. As both Mayor Tory and Dr. de Villa have acknowledged, 1 year ago today, the first case of COVID-19 was confirmed in our city. This unprecedented emergency has taken a devastating toll on many, including the more than 2,300 residents who have lost their lives as a result of COVID-19. I offer my sincere condolences to those who have been impacted so heavily. Since before the arrival of the first case in Toronto, our teams have worked tirelessly to save lives, prevent the spread of COVID-19, and to do all that we can to protect our healthcare system. With those goals in mind, our coordinated enforcement teams continue to work diligently to enforce the regulations in response to COVID-19. The city has taken formal enforcement action 2,066 times to date. This weekend, our enforcement officers continued to monitor compliance with the Reopening Ontario Act. As a result of violations of the Reopening Ontario Act, 6 charges were laid and 8 notices were issued against owners and operators of retail stores, personal service settings, and grocery stores. Our officers also inspected 90 bars and restaurants, resulting in a 98% compliance rate. 2 charges were laid as a result of violations of the Act. I want to thank the vast majority of residents and businesses who continue to help stop the spread of COVID-19 in our city by complying with the public health restrictions and regulations. Over the course of the weekend, 40 charges were laid as a result of the investigation of complaints relating to large gatherings on private property and in private residences. This weekend, Toronto Police also responded to protests and rallies in both Nathan Phillips Square and Yonge Dundas Square and issued a total of 24 charges as a result. This includes 14 charges under the Emergency Management and Civil Protection Act and a further 10 charges under the Criminal Code. Unfortunately, we also continue to experience issues with the use of outdoor ice rinks after hours. Our Municipal Licensing and Standards team, working in collaboration with Parks, Forestry and Recreation and Toronto Police, continue to work together to support safe outdoor activities while protecting public safety. Attempting to access and/or use outdoor rinks outside normal operating hours is both dangerous and illegal. We also remind residents that when using parks to practice physical distancing, to wear a mask as much as possible, and of course, whenever physical distancing is not possible. We are continuing to work hard under the direction of our Medical Officer of Health to ensure that we are ready to roll out a citywide immunization program that effectively prioritizes our most vulnerable communities as very soon as vaccines are available for administration in our city. The administration of COVID-19 vaccine represents hope in the fight against the virus and moves us closer to the day when COVID-19 is behind us and where we can resume all of the things we miss so much. For more information on the response to COVID-19 in Toronto, please visit toronto.ca/COVID-19 for the most accurate and up-to-date source of information for city residents and businesses. Thank you.
Thank you, Chief. We'll now go to questions. Just a reminder to please unmute yourself, and if you're using a phone, please use *66 to unmute yourself. We'll go first to Mark McAllister from City News. Mark?
Good afternoon. A question for Dr. de Villa. The province offered its latest vaccine rollout plan today, once again suggesting it will be later this year before it becomes available to a wider population. I'm just wondering your thoughts, based on the timeline for the vaccines at this point. How long do you think current restrictions and measures should be put in place, and when do you think they would be lifted as a result?
You know, Mark, I think that's $1 million question that we would all love to have an answer to, and I wish I had a simple one for you. Certainly, I can tell you that here at the city, we're working very hard at Toronto Public Health and with our city partners, Chief Pegg and the entire immunization task force, that when the supply does become available, that we here in the local level and on the ground are ready to put out vaccines as quickly as possible and to participate in those efforts to get vaccine into arms in the most timely fashion possible. When it comes to understanding when we might expect that restrictions would change and when life might look a little bit more like what we were used to prior to COVID-19, I think that's still very much a question. We understand that you know, the vaccines do provide, so far, based on the studies that are available, good protection against COVID-19, but I think there are still many unanswered questions at this point in time. So even as we get vaccines out there and even as people increasingly become protected against COVID-19 through immunization, for now, the best advice is to continue with current practices, to continue with self-protection measures until such time as, one, we have enough of the population vaccinated, and two, our understanding on the impact that vaccine has on COVID spread and what we're seeing actually out in the community is better understood.
Based on that last point, do you think we'll be able to ease up on those measures once that the majority of people have those vaccines in their arms, or do we wait for so-called herd immunity to kick in?
Well, really what you want to have is a sufficient proportion of the population appropriately covered and protected against COVID-19. New vaccine, new virus, we don't have all the answers yet, but you can be sure that we are all watching as a global community of public health professionals to try to understand as much as possible. We know that there are many other nations who are, you know, also in the midst of vaccinating their populations and undertaking studies as well. I would like to think that the kind of global scientific cooperation that characterized the rapid development of vaccines might also characterize the relationship amongst the scientists as we seek to understand the impact of vaccine, the spread of COVID-19 in the world after vaccine becomes more broadly distributed, so that we can start to make those decisions in as informed a fashion as possible.
Okay, thank you. We'll go next to Farah Morale from CBC News. Farah?
Hi there. My first question is for Dr. de Villa. You talked about the spread of the UK variant here. There are obviously growing concerns about the spread in the GTA. I'm wondering, on a city level, though, are these new variants sort of changing general approaches the city is taking in fighting COVID-19? I heard you talk about TPH contacting and checking in on enforcement of rules at long-term care homes and other facilities. But is there anything else the city is changing to, you know, its approach in fighting COVID-19? For example, you know, stepping up contact tracing, stricter gathering measures, considering that the UK variant is believed to be more transmissible.
So far, you're asking excellent questions. So first and foremost, we know that the population that is most vulnerable to the negative impacts and to severe outcomes associated with a COVID-19 infection are those who are older, and particularly those within those congregate settings like long-term care homes. So certainly, as you've heard, we've put out advice, and we are specifically asking those types of congregate settings to really do a thorough review and audit of their current practices so that they can be sure that the best infection prevention and control measures are being practiced, that they're being practiced consistently across the board by their staff and all those who need to enter those facilities to provide that essential care to the residents of those settings and homes. So first and foremost, that's what we've done. As well, we're working in partnership with Public Health Ontario and colleagues all around the province. Our provincial counterparts have put out some early guidance around how better to do case and contact tracing so that we better understand what's happening around the variants of concern that are starting to emerge here in the province. So certainly there are heightened practices for case and contact management when there is reason to believe that you are dealing with a case that is due to a COVID-19 infection with a variant of concern. So those are some of the early steps. Again, new variant, still new processes, and I expect that those changes may continue to develop over time as our knowledge on these variants continues to develop.
Thank you. My second question is for Matthew Tory. You'd mentioned this call by the GTHA mayors and chairs today to step it up when it comes to sick pay. You talked about the fact that people are still coming to work sick. You know, we've already heard from the federal government that they're not upgrading the Canada Recovery Sickness Benefit Program. Premier Ford has said he's not going to add anything on top of that. How realistic is it at this stage that either of these governments will heed your calls when they've both made it clear that nothing is really changing?
Well, there's always hope. You know, when you have the mayors and chairs representing millions upon millions of people and they agree as one that this is something that is contributing, and it's shared by the medical officers that advise us that this is contributing to the spread of this virus. I don't know how they couldn't find their way clear, the two governments, to find some resolution to this that improves upon the status quo. What you have at the moment is a benefit, and I give the federal government marks for having one, but the evidence we have from people we've spoken with and people we've been trying to encourage to get tested is that it doesn't meet even close to their current wages. It takes too long to apply for it, and it takes too long to receive it. And the net of all of that is that people just decide they're better off going to work sick. How could it be that we have a situation where people conclude they're better off going to work sick and then almost inevitably spreading, as we've seen from the workplace outbreaks, the virus to other people? And so you live in hope that people are going to do the right thing. And I know certainly from my discussions with the federal ministers in particular that this is something they are constantly looking at and constantly reviewing. I will say I had a conversation earlier this week with Jagmeet Singh, the leader of the NDP, and our parliamentary system works on the basis that people in the opposition get up and ask questions on this kind of thing, and I trust that might have happened today. I'm not sure. But maybe as time goes on and we see that it is having a negative effect on people's lives and on their families and on a whole bunch of other things, some of these changes that I think could be made without too much difficulty will in fact be made. I'm optimistic about that. Just got to keep at it.
Okay, thank you. We'll go next to Shauna Hunt from City News. Shauna, go ahead, please.
Hi there. Good afternoon. My question is regarding enforcement. Is there a Toronto Police representative on the line?
Yes, there is. Inspector Matt Moyer is on the line from Toronto Police Service.
All right. Okay. I'll start with Inspector Moyer then.
Okay.
It's regarding an incident weekend at Yonge Dundas Square. A City News camera operator was gathering footage ahead of an anti-mask protest. The square was essentially empty aside from police officers. Our camera person or operator was alone. He had a mask on and he was confronted by an officer who told him that media is non-essential and he had no right to be in the square, and if he didn't leave that he would be ticketed. So first of all, I would like your reaction to that incident, and secondly, I thought people had the right to be outside and that officers were not allowed to stop people unless they were obviously breaking the social distancing rules. So I guess my question is, if this can happen with the camera rolling, how can the public have confidence it won't happen again?
Okay, thank you. So Inspector Moyer, you'll need to do star 66 to unmute yourself. Go ahead, please, sir.
Yep. Can you hear me okay?
Yes, sir. Go ahead. Thank you.
Thank you, Shauna, for your question. So I'll take the first question regarding the role of the media, and I can tell you that as soon as this was brought to our attention, we did ensure that the officers on scene were provided with the proper information, and it's our information that there was no other issues after that. I think the necessary apologies were made, and any intervention or interaction that was made with the best intentions. Again, simply because we are dealing with a large crowd, a large gathering, and social media. So, like I said, that was resolved and rectified as soon as possible. The second issue, I guess you were asking about with respect to people's right and what is their right when they're outside in terms of their ability to peacefully protest. And we recognize, yes, you're absolutely right. People have the right to peacefully protest, but at the same time, this is a public safety issue. And if somebody is, when we have large gatherings, like we do on the weekend, then the challenge for us is to not only look at from a public safety standpoint, from a public health as well. We have a piece of legislation that we're working with right now that specifically speaks to that in terms of the Emergency Management Civil Protections Act and the stay-at-home issue and the stay-at-home order. And this is what we were using as a guide in terms of our enforcement, our education, and the direction that we were giving people on Saturday. Not an easy task, absolutely, and filled with a lot of challenges when you have a moving mechanism like a large crowd in the young Dundas Square. But nevertheless, I think the situation was resolved adequately.
Yeah, and I just want to quickly follow up on that. I understand the protest and the large gatherings of people, and I understand, I guess, the enforcement that comes under the stay-at-home order with that. Our cameraman, this was before the protest, so he was alone in the square. So I just, for people who are in Dundas Square or out for a walk, how can they have confidence that they won't be stopped, just walking outside by a police officer?
Well, we don't make it a habit of randomly checking people, and we have not since it's begun. That's not the point of it, and it's not our intent. What we were dealing with on Saturday was a large gathering, and if you look very clearly, it indicates and specifies for us our role with respect to large gatherings. We've been issuing the cautions. We've had those conversations. This has gone on for weeks, and now we are in a position where we are using enforcement, and we're issuing tickets. We did run into some challenges with people, but all in all, I think that the messaging that went across, whether it be a conversation or a ticket, sent a very clear message to those that were involved that when you're going to come out and compromise the health and safety of everybody in the city, particularly during a pandemic, you will be walking away with a ticket in your hand at the very least.
Thank you, Inspector. We'll go next to Denise Paglinawan from the Canadian Press. Denise?
Hi, thank you. My question is for Dr. de Villa. I'm wondering if Toronto Public Health is considering testing long-term care homes for any variants.
So thanks for the question. As you know, testing is one of those things that's actually done as part of the healthcare system and is done with clinicians. So certainly at Toronto Public Health, we provide advice on circumstances, particularly in the investigation of outbreaks where testing is warranted. But what is happening right now is that our provincial counterparts, and this we've learned through discussion with them as we are in regular communications with them, there is a provincial plan around trying to understand to what extent are variants present in the province. So they do have a methodology that they have shared with the province and with healthcare providers who are doing testing and those who are doing follow-up. There is a targeted screening process, so people who are identified as, say, for example, having traveled or having been in contact with someone with recent international travel. There are a few other categories of individuals. Those people who are going for COVID testing are being recommended for further screening for variants, and as well, they're doing some studies on the samples that they do receive at the provincial lab, and this is under provincial purview, to determine to what extent we are seeing variants amongst those samples.
Thank you, Doctor. I just asked because I believe Simcoe Muskoka just tested the Barrie long-term care home because they noticed that the virus was spreading really fast at that. So it was the local health unit that. As a follow-up, I'm wondering if you can give me updated numbers on how many cases of the UK variant have been detected in Toronto, if you have them right now.
You know, I'm afraid I don't, but I'm sure we can make those numbers available offline.
Someone will follow up with you, Denise. Thank you. We'll go next to Lucas Meyer from News Talk 1010. Lucas?
Thanks, Brad. Hi, everyone. Hope you're all doing well. Mayor Tory, back to the sick leave discussion, which you, of course, once again called for today. I'm just curious, you know, we just had with the Canada Sickness Recovery Benefit, of course, when the feds came in and said this was not designed for people who went off on vacation, and said that they were going to fix that. Using that example, I mean, when you're asking for a simpler application to whatever sick pay program could be put in place, how would you suggest this is designed so that, you know, we don't fall into what we found with that travel issue where people are kind of taking advantage of it and abusing it? How do you see this working without abuse, and so the people who really need it get it?
Well, there's always going to be people, no matter what application process you have in place, that are going to try to take advantage of it. They're a tiny minority, but they're always out there. I would say in a situation where you've had, in the city of Toronto alone, 2,300 people die from this, where we know there are people going to work today as we speak with the virus or with symptoms of the virus because they're afraid to get tested, that would suggest to me that you could take a chance on having a simpler application process and a more immediate benefit. And then if there are people who take advantage of that, follow up with them later. If you do a lot of this through the different government systems, Revenue Canada systems and so on, you know the name and the address to which people had sent the money. The other alternative we've talked about is having employers made responsible. This probably would have to be mandated by the provincial government, have the employers responsible for providing the sick pay to all of their employees who test positive, and this is a pandemic measure, and then have those companies apply to receive that amount of money back from the federal government at a later time. Bottom line is very simple. People are finding it too cumbersome. The benefit takes too long to arrive, and when it does come, it's not enough to cover their basics for their family, not even close to what they make, and that has to be fixed, or else you're going to have people continuing not to get tested and continuing to go to work sick, and that is putting everybody else's health at jeopardy, and it just can't be right.
Thank you, Mayor. And my next question is to Chief Pegg. Chief Pegg, now that a bit more time has passed, do you have any better idea of when the proof of concept clinic at Metro Convention Center might open up again?
Lucas, at this point, we do not. We are in daily conversation with the Provincial Vaccine Distribution Task Force, and specifically with General Hillier. And that is, those are discussions that are happening literally every day. But at this point in time, of course, they're monitoring, the province is monitoring along with the Government of Canada, the delivery estimates and timelines for the vaccine, and no updated timelines have been provided to us at this point with respect to the resumption of service at the clinic.
Okay, thank you. We'll go next to Matt Bingley from Global News. Matt?
Hi, good afternoon. Dr. de Villa, I was just wondering if you could clarify a little bit more about that case management system that you were moving or migrating to. Are you moving back to IFIS? Or I'm just trying to figure that out, because when the pandemic began and you had to develop your own software, I'm just wondering about what the rationale would be, if in fact it is IFIS, of moving back to an out-of-date technology.
No, so what happened was that in the summer of last year, the provincial government introduced a new case management software, case and contact management system called CCM. And all the other public health units have, since the course of the summer, been able to onboard onto that new system. We're the largest public health unit. We had a significant number of cases, so we wanted to make sure that we had all the preparatory work done in advance. Moving from one technological system to another, as boring as that might be to many, is actually quite a complex undertaking, particularly when we're talking about a large number of records. So we wanted to make sure that we took the appropriate time to make sure that we had all the quality checks and pieces in place to make as smooth a transition as possible. So it is a new software program, it is provincial, and once we are on that system, all local public health units will be on that very same system.
Okay, thank you for that. My follow-up is for Mayor Tory. Just to sort of switch gears here onto the Foundry, there is obviously a pause on the demolition of it until Wednesday. I'm just wondering if you support saving the buildings and what other, if the injunction fails on that day, if you will seek to pursue other ways of trying to save those buildings or preserve them in some way.
Well, I tell you what I am in favor of is everybody complying with their legal requirements and everybody taking the opportunity to consult both the city and the local residents on a variety of issues, including but not limited to heritage. And that was not done in this instance. I understand the effect of a ministerial zoning order, and I understand that it gives broad sweeping powers to the province to do whatever they want. But I think just the kind of considerate sort of partnership we're trying to form with the province on these kinds of developments, even when an MZO is used, would suggest that even common courtesy suggests that you should sit down with the city, sit down with the residents, discuss a variety of issues, including heritage, and that's what I hope will be done in the time that we have available to us. I can tell you right now that while I was very grateful for the fact that the 5 or 6 days were given up until Wednesday, that if that isn't adequate time, and I'm not talking about weeks and months here, but if that isn't adequate time, we'll find other ways to make sure this doesn't proceed without some degree of consultation, and that includes on the heritage side. On the heritage side itself, I don't know enough to be able to judge whether all or part of these structures should or could be maintained or integrated into this development, but I do know that there are people who have studied that. Those studies have not been made available to us in some cases, and so I just think that's what this period of time is meant to do, and I think my sense is that the Minister of Municipal Affairs has a sufficient degree of goodwill to understand that's what we're trying to do.
Okay, thank you. Final question today is to Francine Copen from the Toronto Star. Francine?
Oh, hi, good afternoon. My question is for Dr. de Villa. What evidence has TPH seen of the variant, the UK variant in Toronto, and how concerned are you that it has taken hold here in the city?
So Francine, I think some of the efforts that I described earlier, the assessment and screening that is being done by the Public Health Ontario Laboratory are aimed at getting to answering the exact question that you're asking. So those efforts are still underway. Based on what we've seen from other jurisdictions, clearly we're concerned about doing the very best we can to minimize spread of any variants that may have entered. Again, the best available evidence right now suggests that these are more transmissible. Some estimates have put it at about 50% more transmissible than the standard variants that have been circulating here. Others say as high as 70%. And I suppose as we study more, we'll have a better sense as to what the true estimate really is. But what is good is that we still know what we know about COVID-19 and how it spreads from person to person. And I think, again, it tells us what we need to do is actually in our hands. We know what the self-protection measures are. We know what good infection prevention and control practice looks like. So as I mentioned earlier in my remarks, I do think that at this point in time, as we await vaccines and as we're aware of these new variants, we all have to do our part in infection prevention and control. And at an individual level, that means keeping our distance to the greatest extent possible. And for those who are involved in the provision of services in congregate living settings and those kinds of facilities, clearly making sure that good infection prevention and control practice is being assessed and monitored and constantly improved upon are going to be the kinds of things that we all need to do to minimize the negative impact of these variants.
At this point in the pandemic, I think you and Mayor Tory kind of expressed that we may be a little bit past the halfway mark. Are we comfortably ahead of the UK variant, or could it still send the number of cases soaring beyond what we can manage, beyond what the healthcare system can manage?
Well, I think we're still trying to assess at the provincial level through those testing endeavors that I described at the Public Health Ontario lab, assess the extent to which the variant is present here in the province. And in particular, of course, I'm interested in hearing about the situation here in Toronto. So we're certainly working with our provincial lab partners on that. I do think that, you know, hearing what we are hearing from other jurisdictions, we do really need to redouble our efforts to make sure that we're doing the very, very best we can to reduce the spread. Again, increased transmissibility of somewhere between 50 and 70% is something that we need to be mindful of. And you know, if something like that does take root, you can see that cases would really start to surge, and that would have consequences on all of us, both in terms of, you know, illness and in terms of hospitalization or worse. So again, it's beholden on all of us to really be part of that infection prevention and control solution. It's all of us that need to participate in those endeavors.
All right, thank you very much, and thank you for joining us. That concludes today's briefing. We'll be back here again this Wednesday, the 27th of January at 2 p.m. Stay well.